Hi and hello there everyone. This is Ashmita and you are watching Solution of the PLAB question paper with me. And here I'm going to present you with two questions as I have mentioned in my previous classes also that I'm going to solve two questions in each video so that you all can focus properly. And for interactive discussions and doubt clearing sessions, you all need to join our classes. For that, there are limited seats available, so as soon as possible, you need to join. For that, you can contact on the number that I'll provide with the after the class gets over, and I'll also provide you with link that I'll like pin down in the description box. So yeah, coming back to the question that I'll be discussing now, it is question number 17, and it says a 65-year-old man has pain in his abdomen and is seen on the surgical inpatient ward. He had a closure of his colostomy 5 days ago. His temperature is 36.5 degrees Celsius, pulse rate is 76 ppm, BP is 124 by 82, and respiratory rate is 15 breaths per minute. There is a tender, localized fluctuant swelling 4 centimeter in diameter in the wound. So, which is the most appropriate management over here? A says abdominal support, B says antibiotics, C says laparotomy, and D says local exploration of the wound. There is another option given and which says observation. Your perfectly correct answer would be D, that is local exploration of the wound. Now, diagnosis is kind of a wound abscess following closure of the colostomy. Now, wound exploration and kind of washout would be the first line of treatment over here. So, antibiotics alone would likely be insufficient alone to treat an abdominal wound, although should also be given whilst waiting for exploration. Now, observation is not adequate. The patient is not septic and has no indications of an acute abdomen suggesting an intra-abdominal cause, like we have seen in the paragraph that is given, and thus requiring laparotomy. So we can say abdominal support is not treatment for abscess. Let's continue with the next question, which says 10,000 women underwent cervical cytology. 1,000 had abnormal cells and had a second smear test. 100 of these women were confirmed as having pre-malignant cells and underwent laser ablation. 10 women who were not identified as needing a second cervical smear developed cervical cancer within 6 to 12 months. Which term describes the group of 10 women who were not identified as needing a second smear but developed cervical cancer within 6 to 12 months? Option A says case control group, B says false negative group, C says incident group, D says true negative group, and E says positive group. And the answer for the following would be B, false negative group. Okay, because of like not getting screened properly, um, they were suffering from cervical cancer just within a span of 6 to 12 months. So there was false um, and negative screening of this group. So that was all for today's class. If you want more and more detailed discussion regarding all these kind of questions and topics and terms and terminologies, then you need to join our classes. For that, I'll be giving the like contact number at the end of this video, and I'll also like pin down in the description box the website link so that you all can directly go over there and just fill up the form for your admission. Yeah, that's it for today's class. Thank you for watching. Let's meet again in our next classes.